Okay, let's jump right into the material today. We're talking about electronic nicotine delivery systems, NDS, or what most people just call vaping.
Mm,
The whole idea behind them, the marketing pitch, was always that they're a safer way, right? A
mhm.
safer alternative to traditional smoking.
Right, that was the promise.
But when you actually dig past that surface level, when you look at the big systematic reviews, the meta-analyses,
hmm
what are the numbers really telling us?
Well, that's exactly what we're doing today. Our mission is to take this pile of really rigorous research
Yeah.
and sort of boil it down, make it clear, make it actionable for you, the listener. We need to understand how vaping hits critical things like, well, your heart, your sleep.
And what actually works if people want to quit?
Yeah,
Because that's a huge piece too.
definitely. And we'll also touch on something quite striking, how many future health professionals are actually using these things.
Mm.
But the bottom line from all this evidence we've looked at, vaping is unequivocally not harmless, especially if you're doing both smoking and vaping.
Okay, let's start there then. The big physical risks.
Right.
Let's talk about the heart. We've got sources here comparing different kinds of nicotine exposure.
Yeah.
So what's the overall picture for cardiovascular disease, the composite outcomes, the big stuff?
So the comparison looked at four groups: non-users, traditional smokers, people only vaping, and then the dual users doing both.
Okay.
And the findings. Pretty clear. All three groups, using nicotine smokers, vapors, dual users, had a significantly higher chance of these composite cardiovascular problems compared to people who used nothing.
But there was a difference in how much higher, right, a hierarchy of risk.
Exactly. That's the crucial part. Can you break down those risk levels for us? Maybe translate the stats a bit?
Sure. So the highest risk group, that was the dual users. Compared to someone using nothing, their adjusted odds ratio, think of it like their relative likelihood was 1.67.
Okay, 1.67. What does that mean in plain terms?
It means they're facing about a 67% higher chance of having a major heart or vascular event.
Wow, 67%.
Yeah,
That's a huge jump in risk.
it really is. Traditional smokers were just behind them, about a 57% higher likelihood.
Okay.
But here's the kicker. For anyone thinking, oh, I switched completely, I'm safe now. Exclusive e-cigarette users. They still showed a statistically significant increase, about 31% higher likelihood than non-users.
So even without the smoke, the burning tobacco, there's still a measurable cardiovascular risk. 31% is not insignificant.
Absolutely not. It really challenges that whole safe alternative narrative, doesn't it?
It does.
But, okay, let's zoom in a bit. What about the really sudden acute events, like a heart attack, myocardial infarction, or a stroke? Did those specific risks hold up across all groups?
That's where it gets a little more nuanced. When the researchers looked just at heart attacks or just at strokes separately,
Yeah.
only the traditional smokers and the dual users showed that statistically significant increased risk for those specific events.
So not the exclusive vapors in that specific analysis.
Not reaching statistical significance in this particular dataset, no. However, and this is important, the e-cigarette users still showed a trend pointing towards increased stroke risk. It wasn't random chance. It just didn't cross that specific statistical line in this study.
Okay, so maybe not hitting the threshold for a heart attack or stroke alone, but the overall cardiovascular damage, the composite outcome,
Yeah.
that was definitely still there.
Exactly. The cumulative picture is clear. You can't ignore that 31% overall increased risk.
So why? What's the mechanism?
Mm-hmm.
It's not just smoke versus no smoke.
Hmm.
It has to be the nicotine itself and maybe the aerosol.
It's definitely a combination. Nicotine is, well, it's the core issue. It's a powerful stimulant.
Right.
It triggers this release of catecholamines, think adrenaline, your stress hormones.
Fight or flight stuff.
Exactly. And that immediately jacks up your blood pressure, your pulse rate, doing that over and over again, day after day. That's chronic strain on your heart, on your artery walls.
Makes sense. And the aerosol itself. What's in there besides nicotine?
Well, that's the other part of the puzzle. The vapor carries these solvents like glycerol and propylene glycol, plus various flavor chemicals and sometimes even tiny metal particles that might come off the heating element.
Okay. And what do those do?
Research suggests these substances can cause something called endothelial dysfunction. The endothelium is the super important inner lining of your blood vessels.
Right, I've heard of that.
When that gets damaged, it triggers inflammation. It makes it harder for your vessels to relax and widen properly. And it seems to contribute to raising your bad cholesterol, the LDL, and triglycerides.
Which is basically paving the road to hardened arteries, atherosclerosis.
Precisely. It's a fast track.
So for dual users, it's like a double whammy. You get the intense hit from the cigarette smoke,
Right, the combustion products, the heat stress.
plus this constant chemical assault and endothelial damage from the vaping aerosol and the high nicotine doses.
Exactly. They're really getting the worst of both worlds. It's a synergistic effect. The combined damage is greater than the sum of its parts.
Okay, that makes a lot of sense. So nicotine is clearly a stimulant affecting the heart. Let's follow that stimulant idea. What happens when you use it close to bedtime? Let's talk about vaping and sleep.
Ah, yes, sleep. The connection there is quite strong and very measurable. We looked at a meta-analysis confirming that e-cigarette use is strongly linked to sleep problems,
What kind of problems specifically?
particularly getting insufficient sleep or what researchers call short sleep duration.
And how much higher was the risk for vapors?
The combined data, the pooled odds ratio, showed that e-cigarette users had about a 38% higher risk of not getting enough sleep compared to people who don't use them.
38%.
Yeah.
That's a lot, especially thinking about how many young people vape. Sleep is so critical.
It is. And it's not just duration. Vapers consistently report, poorer sleep quality overall.
Like what? Trouble falling asleep?
Exactly. Increased sleep latency. That's the technical term for how long it takes you to actually drift off. They report more general difficulty sleeping, and maybe ironically, they actually rely more on sleep medications.
Oh, wow. So you get caught in this loop. You use the stimulant, nicotine. It keeps you awake or disrupts your sleep. Then you might take something else to try and force sleep.
Which often doesn't provide truly restorative sleep.
And just messes with your natural sleep patterns even more.
That's the cycle, precisely. Nicotine, fundamentally, is just bad news for good sleep. As a stimulant, it directly interferes with your natural sleep-wake rhythm. It promotes wakefulness when your body should be winding down.
And prevents those deep restorative stages of sleep you need.
Exactly, which your body desperately needs, especially to recover from all that cardiovascular stress we were just talking about.
Okay, heart, sleep. Let's shift to the lungs now. I mean, you inhale this stuff directly. What do the sources say about respiratory issues, like asthma?
Yeah, the evidence there is also quite clear. Using nicotine products, whether it's traditional cigarettes or e-cigarettes, significantly bumps up the risk, both for developing asthma if you didn't have it and for making it worse if you do.
And let me guess. The dual users again?
You got it. Dual users showed the highest increase in asthma symptoms in the prevalence. But it's also crucial to think about vulnerability earlier in life.
How so?
The research highlights that exposure really early on, like if the mother smokes during pregnancy, that can actually impair how the baby's lungs develop in the womb.
Oh, that's rough.
Yeah, and it dramatically increases that child's risk of getting asthma later in life. It has long-lasting consequences.
And for someone who already has asthma and starts vaping or smoking, does it mess with their treatment?
Oh, absolutely. It can severely undermine how well treatments work, particularly the standard inhaled corticosteroids, the ICS puffers.
How does it undermine them?
Yeah.
Makes them less effective?
Essentially, yes. Smoking seems to reduce the body's response to the medication. This might mean the patient needs higher doses of the steroid to get the same effect.
Which comes with its own risks.
Exactly. Higher doses mean a greater chance of side effects from the medication itself. So it's really a detrimental cycle for asthmatics who smoke or vape.
Okay, so we're seeing clear risks: heart, sleep, lungs. Given all this, what's the global policy advice? What are organizations like the WHO saying?
Well, the World Health Organization, they have this framework called Empower for tobacco control. And they're strongly urging governments to basically treat e-cigarettes much like traditional cigarettes.
Wow.
Meaning applying the same kinds of restrictions on advertising, especially advertising aimed at young people, and the same rules about youth access and consumption, at least until we have much more definitive long-term safety data.
So the idea is caution first. Don't assume they're safe.
Precisely. And a big part of that is pushing back against the really aggressive industry marketing that has been so effective at targeting kids and young adults.
Okay, this next part I found really, really interesting and kind of disturbing, honestly. We're talking about the people who you'd think would know these risks best. Health science students, future doctors, nurses, pharmacists. What are the rates of vaping and smoking among them?
It's alarmingly high. Especially looking at studies from low and middle income countries, you often see rates of tobacco or ENDS hovering between 30%, sometimes even 40%.
30 to 40%
Yeah.
of students learning about the dangers of nicotine addiction. That's That's a massive disconnect.
It's a huge cognitive dissonance, isn't it? They might be in a lecture learning about the physiology of nicotine damage 1 hour,
Yeah.
and then stepping outside for a vape break the next.
Why? What's driving that? They have the knowledge.
It seems to be a mix of things. The sources point to, well, immense academic pressure, high levels of stress and anxiety.
Sure, med school, nursing school, it's tough.
Definitely. Plus, curiosity and simple peer pressure still plays a big role. But there's often this critical misperception at play, too.
What's that?
Many of them seem to minimize the risks of vaping. They might cling to that idea that it's basically harmless, or maybe even see it as a legitimate way to quit smoking.
Ah, the cessation tool argument.
Right, which gives them this sort of false sense of security, you know? It lets them justify the behavior while keeping them hooked on the nicotine and the habit itself.
And that false sense of security, that has to impact their future careers, right? How they interact with patients.
Oh, profoundly. Students who use these products often report struggling internally. They find it hard to see themselves as credible health role models later on.
Yeah, I can see that.
And that really compromises their ability to effectively counsel patients about quitting. Think about it. A patient is probably going to be much more receptive to advice from a doctor or nurse who doesn't smell like smoke or duck out for vape breaks.
True. It undermines their credibility right from the start. We're potentially creating a generation of health professionals who can't effectively tackle one of the biggest public health issues.
It's a serious concern for the future of public health delivery, absolutely.
Okay, so if a habit is sticky, driven by stress, addiction, maybe misinformation, what actually works to help people quit vaping? What does the research say about cessation?
Well, there is some positive news on the medication front. There's a specific drug, Varenicline, you might know it by the brand names Chantix or Champix.
Right, I've heard of that for smoking cessation. Does it work for vaping too?
Yes. A recent systematic review and meta-analysis looked specifically at Varenicline for quitting NES, for quitting vaping.
And the results? Was it effective?
It was significantly effective, yes. Compared to a placebo, using Varenicline more than doubled the chances of someone successfully quitting vaping.
Doubled the success rate. That's huge.
It is, and that success held up both right at the end of the treatment period and also during longer-term follow-up checks. So it seems to offer durable results.
How does it actually work in the brain? What's the mechanism?
It works in a pretty clever way. It's called a partial agonist for the brain's nicotine receptors.
Okay, partial agonist, meaning?
Meaning it binds to those receptors and gives them a little bit of stimulation, enough to kind of trick the brain, reduce those intense cravings and withdrawal symptoms that make quitting so hard.
So it eases the withdrawal.
Right. But critically, because it's only a partial activation, it also blocks real nicotine from binding effectively if the person does slip up and vape. So it reduces the reward, too. It tackles both cravings and the reinforcement.
That sounds very effective. Double action.
It is quite effective for many people.
But there are always side effects with medications, right?
Uh-huh.
What did the review find about Varenicline's safety profile?
That's always the crucial balance. The analysis confirmed it's generally well tolerated. However, it did significantly increase the likelihood of two fairly common side effects.
Which were?
Nausea was one, and experiencing unusually vivid dreams was the other.
Nausea and vivid dreams.
Okay.
Usually manageable, but definitely something people should know about.
Absolutely. Transparency is key. For someone really struggling with nicotine addiction, the potential benefit of doubling their chance of quitting might strongly outweigh the temporary discomfort of, say, nausea or weird dreams. But it's a conversation to have with a doctor.
Right, weighing the risks and benefits individually. Okay, that brings us towards the end. Let's try and summarize the key takeaways here.
Sounds good.
So first, vaping, despite the marketing, is definitely not risk-free. It carries real, measurable dangers for your heart, contributing to cardiovascular disease.
Especially for dual users who face the highest risks by far. We saw that 67% increased likelihood for composite CVD.
Right, and even exclusive vapors had that significant 31% increase. Plus, it clearly messes with sleep quality.
That 38% higher risk of inadequate sleep, yeah, driven by nicotine stimulant effect disrupting the sleep cycle.
And it worsens respiratory issues like asthma, and can even make treatments less effective.
And we saw the concerning rates among future health professionals, driven by stress and misconceptions, which has real implications for patient care down the line.
But on a positive note, we do have evidence-based tools starting to emerge specifically for vaping cessation, like Varenicline, which seems quite promising.
Doubling the odds of quitting is a significant step forward, definitely.
So what's the final thought you want to leave our listeners with, looking at the bigger picture here?
I think Despite all this quantitative data, these big reviews, there's still a really significant gap. We need much more qualitative research. We need to understand the social context, the cultural factors, the deep psychological needs of young people using these products, especially in those low and middle income countries where use is so high.
Going beyond just the numbers and the biology.
Exactly. Because moving forward effectively can't just be about banning things. It has to involve building really strong social support systems, psychological support, alongside policy changes. We need a more comprehensive approach if we're truly going to tackle the global reality of nicotine addiction in this new form.
Hey there, and welcome to MedDecode. We're on a mission to prove that medical research doesn't have to be so complicated. Each week, we'll break down complex medical terms and turn them into easy-to-understand health knowledge so you can feel confident about your health. Ready to dive in? Let's start decoding.